Hi, Dr. Goldschneider from the Pain Management Center in Cincinnati Children's Hospital. Let's take a look at the different types of pain, because many people think that pain is just one thing, when in fact it can be divided roughly into two major types of pain. Now let's talk about acute pain first, because that's what most people are most familiar with. And let's say I'm out hiking in the woods here and I trip and suddenly I get pain in my ankle. Well, that pain tells me to do two things. One is to search for the problem, and it won't take me long in this case to figure out I've sprained my ankle. Second thing it does is it tells me to go into protect mode. So I'm going to limp, or I'm going to grab a stick and I'm going to support myself, and I'm going to go and I'm going to take care of my ankle until it heals up, and then the pain will get better because I no longer need to search for the problem and I no longer need to protect it because it's healed up. So acute pain has done a very nice job of taking care of me. And I'm glad of that, because if I developed a tumor or an infection or had a fracture or something, I would want pain to tell me there's a problem and have me go look for it so I can make it better. Okay, so let's switch. Deep breath, and now we talk about chronic pain, where those things are not true anymore. Most of the time, there isn't anything underneath that pain causing the pain. The pain is its own problem, and that's a very, very different way of looking at pain. And I'm going to repeat that. Pain, when it becomes chronic, is its own problem, is its own disease. And so what we do in pain clinic is treat that problem as its own thing to be dealt with. And unfortunately, what we see very frequently is by the time people come to our clinic, they have been in search and protect mode about the pain for months, sometimes years. And they're looking for something and protecting something that isn't there. All right, there is no cause of the pain anymore. The pain is its own disease. And so all they've done is prolong the pain and missed out on that length of time out of their lives. And obviously that's a shame. And that's why when people walk into our clinic, we immediately try to get people functional again. And we'll have a video on how function and pain go together. But we work on the pain as the problem, not as a symptom of something else. That's been taken care of. And the longer we keep looking to search and protect, the longer we have that chronic pain. The more we get into rehabilitating and getting active, the better shot we have of making that pain go away, and while it's going away, getting our lives back. So I hope that's a useful discussion between the differences of acute pain and chronic pain. Search and protect versus nothing to search and protect for, time to get active and rehabilitate to get better. So this is Dr. Ken Goldschneider from the Pain Management Center signing off, and I will see you next time.